with the, let's say, the schizophrenic patient. Okay? This patient with psychosis always saw hantu lah, always hearing voices, ask her to go kill yourself or ask her.
Assalamualaikum and hi, I am your host today, Wafi. Today we are going to discuss about an interesting topic. Since we are going to talk about amino acid and how they are used in medic, especially in mental health, we are joined by special guest Dr. Muhammad Naufal, who has great experience in psychiatric. So Aiman will start the podcast by asking questions.
Thank you, Wafi, and Assalamualaikum everyone. I'm really excited to talk about this topic today, since it's something we don't usually talk about. So let's start simple to build our understanding. Mr. Naufal, could you please explain what are amino acids and how are they related to our body?
Assalamualaikum and hi everyone. Thank you for having me here today. I feel a pleasure to be with you all. So just a disclaimer, it's not that I have so many experience in psychiatry because apparently I just started 3 months ago, but I do get trained in during my housemanship in HUKM. So initially I studied in Egypt for 6 years, and then I continue HUKM for training for 2 years. I ended my posting in psychiatry for 4 months, and apparently I managed to go through psychiatry after that lah. Now I'm basing in hospital UPM. So today I was asked about amino acid and what's the question again? Sorry.
Amino acid related to our body.
Okay, so amino acid is like a how do you say that? It's like a building blocks. Okay, it's a base unit. So amino acids usually built into protein. So in protein itself is like a building block. We imagine it's like a burger, right? So a burger, to have a very good burger, we need a patty, we need the bread, the what do you call it, tomato, cabbage, the sauce. So we're building all this, we're making a burger. Same goes with the protein. So protein is like a building blocks of the amino acids, making it in a form of protein. And how are they related to our body? So protein are very vital in our body. As I mentioned earlier, it's a building blocks, meaning it builds our body. It builds the internal organs, the stomach, alright, the intestine, the skeletal muscle, the muscle tissues, like those going gym, right? So they took protein. People say protein, right? Protein there, protein that. So it's the protein itself from the amino acids building up to make their muscles bigger. And also the protein is not only for the building stuff, it also helps like the immune system. They say if there's like a bacteria coming inside the body, so the body sends signals with the helps of the amino acids. These signals will initiate the works of the police of the body, like the white blood cells. So the white blood cells from other part of the body come to the parts where in our body where the bacteria is intact, so they attack the bacteria over there. That's immune system. There are so many other functions as well, like enzyme production, and then what else? DNA synthesis. When in the sperm, every single cells in our body have their own brain. Like we ourselves, we have brain, right? Yeah. So every single tissue, like our brain or our stomach, they are built of cells. So each cells got their own brain called nucleus. So in this nucleus itself, they got DNAs. So these DNAs are built from amino acids as well. So amino acids are very vital in our body. And then we have so many types of amino acids and so many functions. So we have like around 20 types of the amino acids. Some are essential, some are non-essential. Essential meanings that the amino acids need to be consumed from diets like meat, fish, chicken, eggs. These are essentials, and non-essentials meaning they are produced in our body by ourselves. Okay.
That's a great explanation. It's amazing how something so small can play such a big role, can be vital in our body. My next question is, which amino acids are commonly used in psychiatric treatments?
Okay, that's an interesting question because in psychiatry we deal with the brain of the people, the brain of the patient, right? So before I jump into the amino acids, let me just briefly talk about how the brain function and how it is formed. So in our brain, we have like billions and billions. It's not millions, it's billions of neurons. So it's a building blocks of the small cell, the neurons. It's called neurons. So we have billions of it inside our own brain, and these billions of neurons, each of them have their how do you call it? Have like a connection among them. So it's like a intertwined network, like the spider web. So in spider web there are like so many webs inside, right? So the connection, there are trillions of connections among the neurons. We call it as synapse. So this synapse is like a bridge. So let's say we have two neurons here, right? So it connects between these two neurons are synapse. It's like a bridge. So these synapse, they have their own gates, like their own doors that allow chemicals transferred through the neurons. And this all these things happen less than millisecond. I don't know how fast it is, but it's very fast. So fast. We even cannot detect it only through machine only. Alright. So all this transferring data, chemicals through the synapse, they need these chemicals, which we call it as neurotransmitter. So this neurotransmitter are built through amino acids. So without these amino acids, all these neurotransmitters cannot be formed. So with the lack of the amino acids, these neurotransmitters cannot function well. So the neurons cannot transfer data, all this stuff. So it will make our brain not function well. So there are few examples like tryptophan, tyrosine, glutamate, glycine, myotonin. These are most common in the psychiatry because they do helps in the function of the brain, especially in moods, like in sleep, how it helps with sleep, and then how it helps in the feeling of motivation, right? So like example tyrosine, it helps in the dopamine formation, the adrenaline, the noradrenaline. So these neurotransmitters help in motivation. And also like tryptophan help in serotonin. So serotonin are very important for our mood. So there's low serotonin, there will be depressed mood. So the mood will be low. So someone said he's having depression, someone said he's having anxiety, right? Or we have some patients with schizophrenia, if you ever heard about it. So schizophrenia is like someone can see things that others cannot, or hearing things that other people cannot. Or we call it as a psychotic symptoms, psychosis. So all these are closely related with the balancing of the neurotransmitters, which are building blocks from the amino acids.
Interesting. I never knew that things like tyrosine that can control our mood, or they can give us more motivation, that will had such strong effects on our mood and brain. Let's move on something a little deeper. How do amino acids actually affect brain chemistry and our mental health?
Okay. Just like I mentioned briefly before, we take an example from the serotonin itself. So serotonin is a neurotransmitter. So it comes from the tryptophan, which is the amino acid, right? There's this theory called the serotonin hypothesis. These are studies made years back during the coming of the idea of psychiatric illness. So all the scientists discovered that those patients with depression, or in psychiatry we call it major depressive disorder. So this patient, when they take the bloods of this patient to study the serotonin level, it appears that the serotonin are very low. Very low. So they concludes that with the low of serotonin leading to depression or leading to anxiety. But this is not just the case. Okay, let's go back with the things with the synapse that I talk about right now, just now, right?
The bridge.
So the bridge. So in each synapse we have receptors. So receptor is like the switch. So when let's say the serotonin start attached with the synapse, with the switch, the balance of the mood, the anxiety take place. Okay, but with the lack of the serotonin attached to the synapse of the neurons, meaning that the serotonin cannot attach to it, either because the problem with the switch, the problem with the gate, or the problem of the serotonin level, meaning that there is lack of reaction in the synapse. So this lack of reaction with synapse causing this depression. Okay, and also the anxiety, same. So the theory is around that lah. So the law of the serotonin leading to depression or leading to anxiety problem. So that's why in psychiatry there's come this medication called selective serotonin reuptake inhibitor. What is so based on the name itself, so serotonin is selective serotonin, meaning that in the synapse we have selective switch for the serotonin to attach with. So and then reuptake inhibitor, meaning that after the serotonin take action in the synapse, there is this one entity or one chemical substance called inhibitor, reuptake function, meaning that their function is not to let the serotonin remain in the synapse. So they took the serotonin away. Alright, so with this medication we managed to help the serotonin to remain in the synapse for a longer period of time. So when the serotonin remain in the synapse, meaning that the bridge remain function, so the mood will remain lifted up. So if the serotonin are so fast removed from the synapse, right, and then the mood will be remain low, they cannot be lifted up. These are the studies. Even I myself, I saw patients with depression or anxiety, feeling restless, always have like feeling worthless. They have thoughts about want to pass to get away from this world, do not want to live anymore, right? So with these medications, we manage to lift their mood up. So after, let's say, there's one patient, I started the medication, and the next week I saw her back, and she said she feels okay. She gets better. She didn't cry anymore. She managed to feel like more motivated. There are things that they want to do in her life, something like that lah. So basically, with these medications called SSRI, the easier name is antidepressant. So anti to the depression lah, right? Based on its name. So we prevent the depression to come back again. So we maintain the serotonin level better at an optimum level. With this, it helps to lift up her mood lah. Same goes with the, let's say, the schizophrenic patient. Okay, this patient with psychosis always saw hantu lah, always hearing voices, ask her to go kill yourself, or ask her to like saying that you are not good, kau tak guna, you are not supposed to live here. They hear voices like we are talking now. So this schizophrenic patients, sometimes they talk to herself because she is actually talking to someone that she saw, and she is hearing this third person people, but we cannot hear them, we cannot saw that, we cannot see them. So we can see this kind of patient in the ward, in psychiatric ward, they are talking to themselves. So we give this medication to help these symptoms improve. That goes with the what do you call the glycine, if I'm not mistaken. I almost forgot the glycine, amino acid. So the medication help to balance them out lah. Okay.
Thank you. That really helps us understand how all of this can contribute in our mental health. For our last question, are there any risks or side effect when people use amino acid to help with their mental health?
Okay. I do came across regarding the nutritional part. I mean the supplements of amino acids help in the psychiatric illness. But I rarely endorse this kind of supplements. I never endorse, based on my experience, I never endorse this kind of supplements for any psychiatric patients. But there are studies that do help, but I cannot comment more lah on these supplements. Specific supplements like the L-tyrosine supplement, tryptophan, I'm not sure. But over supplementation do harm your body. Okay, the side effect. So over supplementation, or maybe extra doses of the medication itself do give side effects to the patients. Let's say we started an antidepressant, so some of the side effects, if it's overdose, it can cause you the serotonin syndrome. So serotonin syndrome means, like I said just now, the antidepressant help to maintain the serotonin, right? But if it is overdose, like let's say one patient tried to harm herself, right? She accidentally impulsively consume a large amount of antidepressant. So this will cause her to get serotonin syndrome, which may affect her heart. So the risk of heart to get shut down, or maybe there will problem with the gut, the stomach, the intestine, their functions, the functions of the digestive system. It may affect with these extra medications. So there are risks. That's why each medication that are being prescribed really need a doctor to be monitored. So there are few more risk factors, but mostly if it is extra dose, then the body will get harmed. It will disrupt your let's say for patients with antipsychotics. So antipsychotic meaning want to help with patient with psychosis, right? So they keep hearing the voices. So we want to help her to reduce the voices that she is hearing. But with some medications, extra dose, there are risks to get metabolic syndrome, meaning that there risk to get higher cholesterol level, the body, the increase of patient's body weight, problem with the liver. Alright, so these are the risks lah.
Thank you, Dr. Nafal. It's very help us to understanding more about amino acid in medicines.
Okay, thank you Aiman for guiding us question, and thank you too to Dr. Nafal for sharing about his knowledge. Okay, for our listener, thank you spending time with us, and I hope you learn some from our podcast. So it has been a great time. I am host Wafi bin Indonesia. See you soon. Bye.